Colon cancer, also known as colorectal cancer, is often called the silent killer. It is a type of cancer that begins in the large intestine, also known as the colon. This is the final part of the digestive tract. Colon cancer typically affects older adults, though it can happen at any age. It usually begins as a small, non-cancerous, benign clumps of cells called polyps that form on the inside of the colon. Over time, some of these polyps can become colon cancers. Colon cancer is a disease in which the cells in the large intestine become abnormal and multiply uncontrollably. Over 100,000 new cases of colon cancer are reported each year in the U.S. It is actually the third most common cancer in both men and women, and is responsible for nearly 50,000 deaths each year. Here are 7 signs and symptoms of colon cancer. Number 1. Changes in bowel habits. A change in bowel habits can include diarrhea, constipation, or alternating between the two. Bowel habits are often the first sign of colon cancer. A healthy colon usually has a regular bowel movement every day or two. The stool should be soft, brown, and easy to pass, with no blood. If you notice any changes in how often you go to the bathroom, or if your stools become hard and difficult to pass, it might be something concerning to look after. Number 2. Blood in your stool. Colon cancer is one of the most treatable cancers. If detected early, the 5-year survival rate for colon cancer is 95%. Unfortunately, 1 in 20 Americans will develop colon cancer during their lifetime. The earlier it is detected, the higher the survival rate. Seeing blood in your stool or on the toilet paper can be alarming and can be an early sign of colon cancer. It's important to note that not all cases of blood in the stool are a sign of colon cancer. But it's important to get it checked out by a healthcare professional. Blood in the stool is usually due to inflammation or injury in the large intestine. It can also be from bleeding from other parts of the digestive tract, such as from ulcers in the stomach. Blood can be bright red or dark in color, and can be mixed in with the stool or appear on its own. Number 3. Abdominal pain or cramping. Persistent abdominal pain or cramping can be a sign of colon cancer, especially if it is accompanied by other symptoms like changes in bowel habits or rectal bleeding. In general, colon cancer-related abdominal pain is often described as a persistent, dull ache that may feel like a pressure or cramping sensation in the abdomen. It is worth noting that not all cases of abdominal pain or cramping are a sign of colon cancer. Other potential causes of abdominal pain include irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, and gastroenteritis, among others. A healthcare professional can help determine the underlying cause of your symptoms and recommend appropriate treatment. Number 4. Rectal bleeding. Rectal bleeding can be a symptom of colon cancer, although it can also be caused by other conditions such as hemorrhoids or anal fissures. Rectal bleeding associated with colon cancer can present in different ways, such as blood on the toilet paper or in the toilet bowl after a bowel movement. The color of the blood can vary from bright red to dark, and the amount can range from a few drops to a significant amount. In some cases, the bleeding may be intermittent, which means it occurs on and off over time. If you are experiencing any of these symptoms, especially rectal bleeding, it is important to see a healthcare professional for an evaluation. Early detection of colon cancer can improve the chances of successful treatment, so it's important not to delay seeking medical attention if you have any concerns. Number 5. Unexplained weight loss. Losing weight without trying can be a sign of colon cancer, especially if you are also experiencing other symptoms like changes in bowel habits or rectal bleeding. Weight loss associated with colon cancer may occur for several reasons. For example, the tumor in the colon can interfere with the body's ability to absorb nutrients from food, leading to weight loss. Additionally, the body may use up more energy fighting the cancer, which can also lead to weight loss. If you are experiencing unexplained weight loss, especially in combination with any of the above listed symptoms, it is important to see a healthcare professional for an evaluation. Number 6. Weakness or fatigue too often. Weakness or fatigue can be a symptom of colon cancer, although it is a non-specific symptom that can occur with many other conditions as well. In general, weakness or fatigue associated with colon cancer may occur because the cancer cells are using up the body's energy, or because the body is fighting the cancer. Fatigue related to colon cancer can be persistent and may not improve with rest. It may interfere with daily activities and can be accompanied by other symptoms such as abdominal pain or cramping, rectal bleeding, changes in bowel habits, and unexplained weight loss. Number 7. Iron deficiency anemia. Iron deficiency anemia can be a sign of colon cancer because the cancer can cause bleeding in the digestive tract, leading to a loss of iron. Symptoms of anemia include fatigue, weakness, and shortness of breath. Anemia is a condition in which there are not enough red blood cells or hemoglobin in the blood. Iron is an essential mineral that the body needs to produce hemoglobin. If the body does not have enough iron, it cannot make enough hemoglobin, which can lead to anemia. In the case of colon cancer, the tumor may bleed and cause iron loss, leading to iron deficiency anemia. If you are experiencing symptoms of iron deficiency anemia, especially in combination with any of the symptoms listed above, it is important to see a healthcare professional for an evaluation. Recognizing the signs and symptoms of colon cancer is important for early detection and treatment of the disease. While these symptoms can also be caused by other conditions, it is important to see a healthcare professional for an evaluation. Routine screenings, such as colonoscopies, can also help detect colon cancer in its early stages, even before symptoms develop. Remember, early detection and treatment can improve the chances of successful outcomes and can save lives. That's a wrap on today's video. Don't forget to like, share and subscribe for more health and wellness content.